The American Dental Association recommends flossing at least once a day, but what does it mean if you don't? Our Verify team explains.
Okay, so be honest. Is flossing really a part of your daily routine? Well, the American Dental Association recommends flossing at least once a day, and there is research tying flossing to heart health. So does that mean not flossing actually turns into heart disease? Let's get the facts. Our sources, cardiologist Dr. Paul Coley, Dr. Sasha Ross, periodontist for the Cleveland Clinic, the American Dental Association, and a study published in the National Library of Medicine.
There's really a very strong association between the two, where patients that have periodontal disease are at a much greater risk for having, heart disease.
Dr. Coley also reiterates that people who have gum disease are at a 2 to 3 times higher risk of developing heart disease. This study shows gum disease is associated with inflammation and bacteria in the heart.
The plaque in the heart, around the heart and the arteries that causes strokes and heart attacks is made up of cholesterol deposit and inflammation. And what we find is that bacteria from the mouth can sometimes be found in the plaque around the heart.
However, according to the American Dental Association, while there is evidence of a correlation between gum disease and heart disease, it's not clear whether one causes the other.
This is just a marker for poor general health. You're not taking care of your gums and you're not taking care of your heart. Or is there something causal? In other words, does the bacteria that builds up in your mouth or the inflammation that builds up in your mouth lead to more systemic inflammation that can also cause hardening of the arteries or cause that bacteria to create inflammation in the arteries? That we don't yet know.
Dr. Ross notes the risk also depends on the person. Some people who barely floss or brush have no heart problems whatsoever. As doctors continue to study the connection between the two, both Coley and Ross say keep good hygiene and good health. It certainly wouldn't hurt to add flossing to your routine. With your Verify Fact Check, I'm Megan Bragg.